Hi, I'm Dr. Ayn Kerber. I'm the medical director of Hospice of Evangelical, and I'm also a family medicine physician within our hospital system. I really appreciate the opportunity to talk with you today about what our hospice program has to offer and hopefully answer some questions or perhaps bring up some ideas for thought for you. In talking with families over the years and also with some of my colleagues, I think one of the perceptions of hospice that can sometimes be misleading is that it's care that can only come in right at the very end stages when people are transitioning into their active dying process. And what hospice truly can offer is so much more than that. It can be a challenge to figure out when do I start thinking about hospice, or perhaps when do I start asking about hospice. And what hospice is, it's a benefit of the Medicare system, and the criteria per se is that an individual is entering into the end stages of a disease process, so that the expectation is 6 months or less of life. And that can seem a little daunting. How do I know? None of us know for sure what life has in store, but when you start to get into situations where treatments just aren't working anymore. And it's not just disease like cancer. We also see people in the end stages of heart disease, lung disease, where they can go in and out of the hospital. They're having trouble with breathing, and it's a very panicky feeling. They're at home, they don't know what to do. So in and out of the hospital, it keeps happening, and the quality of life is becoming very poor. Neurologic diseases like Parkinson's disease, Alzheimer's dementia, where individuals are just in slow decline, perhaps falling more at home, losing their appetite, losing weight, becoming restless, agitated. Again, and the treatments just aren't helping. These are times that you can reach out to your primary care provider or perhaps one of your specialists and say, we're just not doing well. Treatments aren't working, it might be time to consider hospice. And they can reach out to us and we can come and meet with you, talk with you, come to understand, all right, where are we in the process, and is there a role for us to help? When hospice comes in, they bring with them a wide range of caregivers. So we have nurses that come to the home that can help managing medications, they can help to manage symptoms, they can also talk with family members just about the whole process and what they're seeing, guide a family through these end stages of disease. And what we find is the longer those nurses, those caregivers can be with an individual and with a family, the more benefits that we can offer. So some of the other things, in addition to nurses, we have caregivers that come in typically once or twice a week, sometimes less, sometimes more, depending on what's going on. But you have continuity, you have the same people coming in, helping with things like bathing, positioning, understanding skincare, teaching the family how to also help their family member. And that's just an invaluable skill to be able to do, to feel like you have some control, some understanding of how to help. We have spiritual support. There's a pastor that can come in and work with you, pray with you if that's something that you desire. We have a social worker that can help to just rally support for you. That can, if you need a hospital bed, if you need extra care in the home, perhaps help with the paperwork to take time to be able to stay home and care with your loved one. These are all things that we can provide. And when we get feedback from families after their loved one has passed, they're always surprised by just how comforted they were, not just by the support in those end stages of the dying process, which of course is invaluable just to help to understand the transition, what's happening to their loved one, to their bodies, but just the ongoing support and how hospice can help to improve the quality of those last 6 months, should that be the amount of time that's left. Maybe a little more, maybe a little less, again, we don't know. But the sooner hospice comes in, when we decide, okay, I don't want to go back to the hospital anymore, we aren't going to be able to cure whatever it is that's plaguing us. We can just really help people to live a better quality of life on their terms, more fully supported. And it's just a very, very precious thing to be able to help provide that. So if you're just not sure, ask. Reach out to your family doctor, to your primary care physician, to your specialist, and say, you know what, we're ready to have a conversation about hospice. We're always available, always ready to talk, and all you have to do is reach out, and we'll be happy to help to understand, is hospice the right thing for you, and what can we do? All right, take care.